Hello, and welcome to this very special edition of coronavirus, also known as COVID-19. I'm your host, Dr. Mandira Mehra, and this is The Human Condition, MD. If you haven't heard it yet, don't forget to check out the completely free podcast, Human Condition, MD. It's available on iTunes, iHeartRadio, Google Podcasts, and other platforms. If you haven't seen it or you miss it there, you can of course check out the website, www.humanconditionmd.com. Let's today take some time to answer the frequently asked questions from our viewers about COVID-19. First of all, what are the signs and symptoms of COVID-19? COVID-19 is called COVID-19 because of the year 2019, not because it is the 19th strain. While coronaviruses are not new to the human species, this unique strain is different. This is an enemy that we've never seen before, and every day we are discovering new effects, new symptoms, new signs, and this makes it a challenging enemy to combat. Now, some of the very common signs and symptoms can include, but are not limited, by respiratory symptoms, for example, cough, shortness of breath, runny nose, fever, generalized malaise. Now, you may think to yourself, well, Dr. Mehra, I may have some of those symptoms with allergies or with the flu or with other illnesses. And you're absolutely right that many of the symptoms overlap with other conditions. What makes this unique is it does have a higher mortality rate than, for example, the influenza. Now, 80% of people that are infected with COVID-19 will have a mild case. For example, runny nose, cough, perhaps a fever that eventually subsides. And while we don't have any known treatments to date, there is supportive care. If you have mild cases or a mild symptom, there's no need to go to the emergency room, rush to your urgent care. However, at any point, if these symptoms become severe, for example, you have shortness of breath, the coughing is persistent, then of course seeking emergent care or going to 911 is always recommended. Do not delay. If it's a loved one and they are unable to tell you they're having shortness of breath, look for signs for that. Perhaps work of breathing where someone is gasping. Of course, if lips or any extremities are blue, this means there's an oxygenation issue. And of course, in this case, also seek emergent care. Other signs and symptoms of COVID-19 may surprise you. We have noticed that it actually affects every organ system in the body. We can start from the head and work our way down. So for example, the head, the brain, neurologic processes. Higher incidence of stroke has been noted in these patients. A very popular study out of Thomas Jefferson University has just been released. In this paper, it noted that the COVID-positive patients presenting with stroke were much younger than your typical stroke patients and without stroke risk factors. For example, 30s, 40s, 50s. Generally, a stroke population is much older than this. Secondarily, that population had a much higher mortality rate, unfortunately, of about 50%. Now, when you compare that to a normal stroke population, the mortality is about 10 to 15, so 50% is much higher. Now, we have to keep in mind that in this population, when the mortality was higher, it wasn't necessarily because of complications of the stroke, although that was the case in some cases. It could have been because of other organ involvement, for example, kidney failure, liver failure, and other coagulopathies, which is a fancy word for clots in the body. Speaking of clots in the body, that is another sign or symptom that's noted here, is for some reason, the COVID-19 virus creates a cascade, or think of this as a domino effect, and we've noticed more clots in patients. Along with clots, liver enzymes in hospitalized patients has been increased, which means the liver is involved, as well as potential kidney failure. When the kidneys are involved, unfortunately, this makes the complication rate, and again the mortality rate, higher. We are also noticing that symptoms of chest pain, shortness of breath, cardiac things like an MI or heart attack have also been involved in COVID-19. Very surprisingly, or not surprisingly, the CDC recently added other signs and symptoms. For example, loss of taste or smell, once again going back to COVID-19 and how the virus is attacking the nervous system. I don't mean to say any of this as a cause for alarm or anxiety. The purpose of knowing this information is to look out for signs and symptoms that you may not commonly think of as COVID symptoms, COVID-19 symptoms. Also, about 20% of patients that have tested positive for COVID-19 report having some GI or intestinal involvement as well. And biopsies have confirmed that the virus also affects the markers, the inflammatory markers in the intestines. So do not be surprised if, for example, diarrhea is also a symptom that's felt from COVID-19. How do you know if you're a high-risk patient? A high-risk patient may be someone that is elderly, in a nursing home, any age person with underlying health conditions. For example, diabetes, hypertension, heart disease, respiratory diseases, for example, COPD. If you have a history of smoking, this is a great time. It's always a great time to stop smoking. But of course, smoking cigarettes also makes you more susceptible to COVID-19. A very popular question we get is my child or our children considered high risk? Now, while children are generally considered high risk for many diseases, what's interesting about COVID-19 is it can infect children. However, they tend to not get as severe an illness as the adult population. This mechanism in this model is still being studied, but what we know for now is we still want to protect them the same way that we protect the adults. However, they're not considered necessarily a high-risk population. As things begin to open up and the world in the post-COVID era returns to normal, I say normal in quotes because normal post-COVID may never be the normal we knew pre-COVID. That being said, social distancing is still important. Wearing masks when in the community is still very important. And ultimately, hand hygiene and disinfecting surfaces, hands, other things that may be contaminated is also critical. The reason being, these sound like non-pharmacologic, non-medical solutions, but at this point, we do not have a known vaccine and we do not have one magic pill or medication that treats all of these symptoms. That being said, we have to resort to these other types of preventative care. A great question that we get is, should I be tested? Now, this is going to be a dynamic answer that depends on our current state of affairs, depends on your local state officials and their regulations. And ultimately, if you are employed somewhere, certain employers are now requiring COVID testing to return to work. There are different types of testing, and we'll discuss that in the future. PCR, antigen, different types of blood tests, finger stick versus blood draw, and we'll address that in the future. But for now, the important thing is, the only way to know if you definitively have the COVID-19 is by getting tested. Signs and symptoms may say you are likely to have it, but you won't know until you have it, the test. Now, what's interesting is you can be completely asymptomatic. Asymptomatic is a fancy word for no symptoms of COVID-19. You can be walking around without a fever, cough, shortness of breath, but you may actually be infected with COVID-19. Now, how is that possible? Again, the answer is not completely understood, but what we know is that there is something called silent spread or silent carriers. Now, there's 3 categories of silent carriers. Number 1 is the individual that has COVID-19, however, is asymptomatic, is blissfully living their life, unaware that they have the virus, they have the infection. Now, this person, unfortunately, while unaware, can still spread this to others. The second type of silent spreader is someone that is pre-symptomatic. Fancy word for, before you manifest the symptoms, you're already infected, but for 3 to 5 days, you may not manifest the cough, the shortness of breath, and all the other symptoms we just discussed. In this case, again, you're considered a silent spreader because you can still spread the infection to others. However, you're unaware yourself that you have the infection. A third type of silent spreader is an individual that will manifest mild symptoms. So symptoms that may be regarded as not severe enough to go to the hospital or warrant investigation, but just mild enough symptoms that they may feel fatigued, malaise, maybe a slight runny nose. But ultimately, all 3 categories of silent spreaders can transmit the virus to others. What is an N95? An N95 is a very popular mask that is known to healthcare workers. Healthcare workers often have to wear these when exposed to certain diseases. It blocks out about 95% of the particles, hence the name. Now, while this mask is excellent and recommended for doctors, nurses, frontline warriors that are combating this COVID-19, if you're at home or in the community, it is recommended to reserve these N95s for those frontline warriors. Now, there are other masks that you can wear or purchase. As long as they cover the nose and the mouth, they can be handmade, they can be purchased through multiple avenues, for example, online, in stores. It is still recommended to wear this mask because it provides a certain degree of protection. Ultimately, as life returns to normal, we cannot forget about our mental health. Our mental health is often ignored, often stigmatized, but COVID-19 has spared no organ system, including our emotions. Now, our emotions may be a little out of control right now. Perhaps you're not sure what you're feeling. Perhaps you feel anxious. Can I return to work? How do I reacclimate to society? My kids are home from school. How do I pay the bills? We've gotten a lot of questions, concerns, and comments. First and foremost, if you ever have thoughts of harming yourself, harming someone else, definitely reaching out to 911 is the most important thing you can do. There's help, there's support available for you. Number two, if you're having any of those other feelings or symptoms we just discussed, please reach out to somebody, whether that is your physician, a therapist, oftentimes friends, family, religious organizations, and pastors, priests. These kinds of things can also provide support. But ultimately, do not feel alone. We are all together in this battle against COVID-19, and we'll come out of this on the other side. Last but not least, we're asked the question, if I've been infected with the COVID-19 virus, does that mean I am now immune to the virus? Does that mean I will not get reinfected? Now, the official answer from the CDC and the World Health Organization is, we don't know yet. In other words, there have been some reported cases of individuals that had COVID-19 and after some time tested positive again and exhibited some mild symptoms. This would lead us to believe that you're not immune and perhaps you can be reinfected. However, further studies need to be conducted and we need to confirm this. It is still possible that once you have the immunity and the antibodies have developed, that you will be immune to this. And that is, of course, the hope. But we're not sure. So more to come on that, and stay up to date on that dynamic situation. Once again, this is Dr. Mandira Mehra signing off here. Human Condition MD. Don't forget to check us out on our podcast, Human Condition MD. That's on iTunes, iHeartRadio, Google Podcast, pretty much you name it, and we're there. If we're not, let me know. But if you miss us there, you can always check us out on the web at www.humanconditionmd.com. Stay happy, stay healthy.